Welcome to Dermat. After announcing that we are going to have a regular podcast from this week, we this is our first podcast. The reason of doing this podcast is anything we can discuss in detail, not in a very short way or not in a very you know fast way. We have to go in deep of that. We have to dive deep into the world of veterinary dermatology. So I am having Dr. Naveen with me. He has just cleared his naval examination, and we will be also talking about how can our veterinary students who are in the second, third year, or we just completed in the final years, or just completed their BBS and AH, how they can do the naval examination and prepare for that. So Dr. Naveen will be asking some questions to me, and I will be answering those questions. So Dr. Naveen, tell me, yeah.
Hello, sir. Welcome to Dermat Vet. So, as I am a junior veterinary doctor, so how can I approach the dermatological case?
Okay, yeah. See, uh, if you know that any case which is coming to you means there are 80% chances of that case is definitely suffering from some kind of dermatological disorder, whether it may be bacterial infection, whether it may be parasitic infection, it may be a fungal infection, or some immune disorder, or some hormonal disorders, or some nutrition deficiency. So it is a very difficult to pinpoint that this case is suffering from this infection, because many a times you will find these infections are very much mixed infections, and you have to act like a detective, to examine those cases. So you would not have to be in any hurry to examine a case. You should have ample time. You can have to give, at least for my dermatological examination, I take around 2 hours for a complete diagnosis. Many a times I find it is atopic dermatitis, either malassezia dermatitis, it is bacterial pyoderma, it is demodicosis, a lot of times it is hormonal imbalances, endocrine disorders, but we have to give time. We cannot bypass that step. Time management is very important. We have to give ample time. We have to use all the steps. We cannot surpass any steps. Like many a times I find that many of the doctors or the vet doctors who are dealing with dermatology, they are not using cytology, and they are also not using uh, proper history taking. So everything starts with a good history. Yes.
So, how to approach throughout the history, sir?
So first of all, very important is the body weight of the dog.
Okay.
Secondly, the temperature of the dog. Thirdly, the physical appearance of the dog. Then you have to talk to the client. First question you should ask the client: how much the dog is pruritic, how much is the itching score, and you have to ask the client whether the dog is itching in any particular season. Then you have to ask the client what food they are giving to their pets. Many times it is the case of allergies, food allergies. There are food allergens which are responsible for all this infection. So you have to ask them. You have to again ask them whether which kind of food they are giving. Also, any treats are given to their pets. What kind of treats are those treats? Again, you have to ask them whether they are using any floor disinfectant, because floor disinfectant also plays a major role in determining which kind of infection the dog is suffering from. Also, many times it is a tendency, general tendency of washing the paws. So we have to ask them, are they washing the paws of the pets? Again, you have to ask them whether they are taking the dogs in the garden or on your the shrubs or some small plants for answering their nature's call. Also, you have to ask them, the dog is itching in the night hours, is he itching in the daytime. Also, you have to ask them what floor the dog is staying, whether there are pigeons are surrounding that flat. You have to ask the owners any construction activity going on around their house, because he may be suffering from, the dog may be suffering from dust mites, dirt mites. You have to again ask the owners that whether this dog is suffering since childhood, or whether is there any case of gastro infection in the childhood. Also, you have to ask the dog is suffering from any infection of platelets, like thrombocytopenia, so whether it is any parasitic infection. So all these questions you should ask them before answering these clients, because many times small thing is there, and many times it happens that the dog has visited a grooming parlor and the thing has started. The dog has visited any shelter house or any kennel, and the problems has started. So unless and until you ask these questions in a very detailed manner, you won't be able to understand exactly what the dog is suffering from. Yes.
Okay, I understand that minute details also.
Minute details are very much important. Yes, doctor. Yeah.
Okay. So we are off with the history only.
Exactly, the prior history is very important, and unless and until we take time, and what I have done, for a very saving of the time, I have one scanner. That scanner, if you scan that thing, there is a Google sheet. On the Google sheet only all these things are mentioned, like when is the last deworming done, are you using any isoxazoline Next Guard, or Simparica, or what food they are giving. All these questions are there in that Google form. So once the patient comes to me, I give 10 minutes for him to fill that form. That forms comes to me when I'm examining the patient. I just scroll around that thing, and it is easy for me to pinpoint the diagnosis. Yes, yeah, yeah. Yes.
So after taking a history, what are the diagnostic methods you will follow in your clinic, sir?
Yeah, very important is, first of all, I use my Woods lamp. Then I use my once I use my Woods lamp, I come to know at least 20-30%. Then I use my dermatoscope. That dermatoscope gives me a clear insight, clear picture of the epidermal layers and the complete trichogram. Then I use my microscope, which is my favorite instrument. I am using cytology, skin cytology. I am using it for the ear separately, for the skin separately. Also, I am using tape impression smears, and also I am using taking the skin scraping for examination of some any parasitic infection is there or not. These are the standard protocols which I do on a very day-to-day basis when I am approaching any dermatological patient. Yes.
Okay. So in the diagnostic parts, the endocrine issues also matters in these dermatological cases.
Exactly. One thing I forgot to mention is the blood work. Blood work is the major role is the blood work, because that is going to be the final diagnosis. So what we generally ask to take first is the CBC. CBC will tell us the hemoglobin and the blood picture and the platelet counts. Then we do the liver function test, kidney function test. Then we take the glucose level of the estimation of the glucose level. Then we take the IgE, that is the if the dog is suffering from any allergic issues. Then we take the cortisol levels. Cortisol, we are very, many times we are not, taking cortisol examination into consideration. And this definitely helps us to know, understand that the dog is suffering from any endocrine disorders. Yes.
So after you reach your final diagnosis, so how would you follow the generalized treatment plan in these dermatological cases?
See, generalized treatment plan is very simple. We use very those medications which will, the dog will not be used to. Many times, though those patients who are coming from very far places, they come to me saying that, doctor, we are following the medication of various doctors, and once the medicine we stop the medicine, the disease again comes on the same, on the dog. So these are reoccurrent issues. We don't want the pets to be dependent on the medicines. We want his we work on the immune mechanism of the dogs, his hormonal balancing his hormonal imbalances and overall health. And unless and until we see the root cause, the underlying cause of the infection, we won't be, treat him on a very, complete treatment. Because see, giving prednisolons or like any liver supplements or some antibiotics, antifungal, this is not going to help. We have to see that dog is without medicine and he stays fit throughout his life, even after we stop the medicine. This should be our, pattern of treatment. Yes.
Okay. So at the end of this podcast, what are the advices you will give to the young veterinarians like me and to the pet owners as senior dermatologists?
See, first of all, give ample time to each case. Don't be in a hurry. Just giving 3 injections and 4 tablets is not going to help us. We have to give at least 2 hours. I know it is not practically possible, but unless and until we go to the depth of that, I want the patient should not come to me again. He should be, free of all the medications. And also, very much important is the bathing pattern. What kind of bathing and what kind of shampoo the dog is using, and how frequently it is given bath. These cases, they require bathing every 7 to 8 days. So this awareness is very important. Yeah. So
So thank you, sir.
Yeah.
Thank you for your valuable information.
So, doctor, one more thing I would like to ask you. In our next episode, what we will be talking to you is how you crack that naval examination, and how can our young graduates or those students who are in the second or third year, how can they prepare for naval? And India is there. There are a lot of opportunities in India, but there are opportunities beyond our country, like in Dubai, Canada, and Australia, New Zealand. How can our vets go and practice there? So thank you for watching Dermat Vet,
Thank you.
and thank you, Dr. Naveen.
Thank you.
Thank you. Thank you. Yes. And my dear friends, hope you like this episode, first episode of podcast episode of Dermat Vet, and we will be coming in our next episode with more and more content which you will be liking. Thank you for watching Dermat Vet.